I'll start rolling. Let me just put my record button on. Right. Good morning, everyone.
Good morning.
Welcome again to the second edition of our CAWASA HR webinars. Again, I must apologize for giving you the wrong time, which originally we had all agreed for 10:30, but I had it logged in at 10. But here we are. It's about 10:15, so we'll get going, and I'll hand over to Sheree.
Okay, good morning. Thank you very much. Thank you to those who are here on time, and for future, we'll give him, Mr. Shaw, feedback if we see the time is wrong. I really wasn't quite sure what to expect, so I just decided to plan for 10 o'clock. And so I will share my screen. Very good. Just give me one moment. Share. There we go. Okay, so today is really to help us get more prepared as environments will be changing. I had a quick little chat with Mr. Jean just pre-start here, and I do understand that some of your tourism locations, hotels, are hoping that in October you can start to expand. And it's going to be important for each organization within the islands to have their own plans in place. So what I'd like to do today is cover 2 to 3 areas: the overall impact of COVID-19 for the HR department and some of the challenges that we're facing. And in that area, I'd like to present a few slides as well as open up some discussion. The idea is, if I can get some of your feedback, perhaps give you some comments at this time, and if I don't have answers or information, perhaps do some research and present that to you at another time, either by email or by a follow-up webinar. So your involvement is going to be really helpful in that section. We're also going to look at a bit of a debrief regarding work from home, now that pretty well most of the organizations on the island have their people back in the office. And we're going to look at some of the challenges and some of the success stories that may have occurred. Again, that's going to be a section where I really will ask for you to join in either on chat or verbally, so that we have an actual discussion going on. Not a lot of presentation in that section, other than on the conclusion, where I've got some tips just in the event of any reason that you have to have your people work from home. There's a few tips that have been shared here in Ontario that have been quite helpful. And then the last section of today's discussion will be expanding the bubble. Here in Canada, we've expanded our bubble. Just a quick understanding of what a bubble is here. In Canada, a bubble started out where for several months, actually 3 months, the bubble was only members of your own household. That meant if someone was not living with you, they were not part of your bubble. And people were subject to being charged if their vehicle was found in someone else's driveway without a specific medical reason. So for example, I've been helping at a seniors retirement home, and I had to have a letter in my car to be able to travel between work and home, because there was a potential that I could have been charged because they were asking everyone to stay home, and they were very serious. And it was shared on the news, a number of circumstances where people were charged up to $1,000. So they got very serious about that. And then after 3 months, the bubble was expanded to 5 people outside of your home. And then the next month it was expanded to 10 people outside of your home. We are still only in a 10-person bubble. That means that you have designated 10 people that don't live in your home, that are family and or friends, that you're allowed to associate with and not have to wear a mask or or be on guard. That means you can share meals, you can, you can sit and have conversations. Outside of that 10 person, you must keep a social distance of 2 meters, or you must be wearing a medical grade mask. So it's gotten quite serious here. Now, with school having started this week, the children, the teachers, everyone is required to wear the mask, and everything is done in a staggered. Unfortunately for us in Ontario and in Canada, the numbers of COVID cases are starting to grow again. So as we open our bubble, we're discovering a lot of challenges. And so organizations are preparing, and we've an informal agreement, because it's not been broadcast yet, but we sort of have an informal agreement among business people that we're already in the second wave, and how are we being prepared. So that just gives you a quick background on what's going on here in Ontario/Canada, and some of the experiences that I'm involved with, and perhaps helping me to be able to share information that might be useful to you, provide some answers for areas where you might have questions as you start to expand your bubble. So before we actually get into the presentation and our formal discussions, are there any comments or questions at this time? And again, I'm going to pull up my chat, make sure I'm there with that. Where did it go? Oh my goodness, it's gone. More. You can send a question in the chat, or you can make a comment, whichever is most comfortable for you. There, my chat's open. Any comments at this time? I'll give a moment, because there always seems to be a bit of a delay. The chat disappeared. Okay, Mr. Jean, I'm just going to ask for quick feedback. Am I being heard?
Yes, I'm hearing you.
Oh, perfect.
I think we have 2 more have just joined us, so.
Okay,
Yeah,
and I did ask for that feedback, because for some reason I keep pressing chat and it's gone away on me. So
yeah,
I'm
the
not
chat
seeing.
is there.
I don't know why
Somebody
mine
says there is some feedback. They said no questions.
I lost my chat.
You go to the bottom of the screen.
No, I see. I keep pressing on chat and it keeps disappearing.
Shouldn't.
Which makes it difficult, and when people are
Well,
making
I'm
comments.
monitoring it, so I'll let you know.
Okay, because that makes it difficult when people are making comments and I
Yes,
can't see it.
yeah, some people are saying, yeah, they all hearing you, so that's fine.
Okay, excellent.
I don't think they have any questions over it.
Okay, so if you can help me by monitoring that chat and perhaps jumping in if something comes along, then that'll be great. Okay,
Sure.
Thank you so much. Okay, so impact of COVID-19 on human resources. Well, there's quite a challenge for the work, I believe. I know here there's quite a lot of challenge for human resources. The paperwork has probably more than tripled because with us not having school for 6 months, it's almost a little bit of humor. But we have March break, which started I think around March the 12th, and the students went back to school this week. So the joke on the radio is March break is over now, the 6-month March break, which is normally 1 week. And that meant that a lot of parents had to make arrangements to stay home from work, because not only was there no school, there was also no daycare. Daycare only started again at the end of August. So any parent with children could not have the opportunity to go to work because they had to stay with the children. The second challenge is that typically grandparents are daycare, and they were not allowed to be with the children because they were not in the bubble. If they're not living in the same home, they were not allowed to babysit. So we had quite the HR challenge within our organizations. For example, I was helping out for the last 6 months at a facility because one of the young ladies had to stay home with her daughter. The daughter started back to school on Monday. The young lady started back to school to work on Wednesday. And I was helping yesterday afternoon when she got called and had to pick up her daughter and take her to the hospital for a COVID test. And I heard the little girl in the background, I don't want COVID, I don't want COVID. And it was really sad because the challenge now for parents and children, it could be a simple cough, or unfortunately, we Canadians suffer a lot with allergies. Every season change and every allergy response could create a circumstance where the person is required to have a COVID test. At the organization I'm at, they are requesting, not making it an absolute necessity, but they're asking that everyone be COVID tested every 2 weeks, just to keep monitor on the situation. Because one of the big issues that we and you as a country are going to face when your bubble is opened is the opportunity for the asymptomatic persons who are carriers but show no symptoms. And that's where the challenge will be. Not to create a lot of upset, one of the areas that we are noticing is the reduced strength of the virus, the number of illness that require medical attention. I don't know the actual numbers, but I do know that they have reduced tremendous. For us in Ontario, the number of deaths, which luckily was never really high as compared to other countries like the US, but because Canadians are overly cautious and extremely sensitive, every single death was considered more than should be. And so we still consider every person that dies as a result of COVID a very sad occasion. And even though the numbers are down, I think in Ontario, perhaps we're having maybe 3 yesterday. It was very small. If it wasn't 3, it was maybe 1, compared to the thousands that are dying in other countries. But for HR now, making provisions, and one of the areas that's important for HR is the constant change. Human resources, I believe, are starting to feel like they're bobbing and weaving on a daily basis, because we constantly have change of adding requirements or removing requirements, and making sure that the information is shared among all employees, managers, and stakeholders can be a little bit challenging. Now, part of the requirement of being more agile is having to learn new skills. For example, I believe it's happening as much or almost as much for you in regards to taking the temperature, also ensuring that persons are constantly sanitizing, making sure that not only are people wearing masks, but that the masks are fresh. So if the medical masks are being replaced on a regular basis, if there are circumstances where one is allowed to use a cloth mask, that they're being washed, because one of the fears is that people feel like, okay, I'm wearing a mask, but they're not ensuring that the mask is sanitary, and that then it becomes not only redundant, but it also becomes dangerous. Because when testing was done on the lifespan of COVID, and I don't believe I've shared that with you, but I have a sheet of information on the expected lifespan of COVID on surfaces. So if anyone's interested in receiving that, please send me a note in the chat, and I will, if I get several requests, then we'll send it to everyone. But it shows the lifespan of COVID on cardboard to be approximately 2 days. And it shows the area that the COVID germ lasts the longest is on the medical masks, because the medical mask has a piece of metal inside, which is used to squeeze and form around the nose. And the COVID-19 germ lasts on that surface for up to 7 days. And that's very overwhelming when you realize the product that you're using to protect yourself is also the product that can endanger you the most. So handling of masks, another area that HR and people in general need to learn about is wearing gloves. Everyone assumes that if I wear disposable gloves all day, then I'll be protected because my hands are not coming in contact with the virus. I learned from the health unit representative that they recommend not wearing gloves except in very specific circumstances. So on a daily basis through the day, it's recommended not to wear the gloves, but to wash your hands with soap and water as much as possible. When not possible, to use the hand sanitizer. Only use gloves for very specific situations. If you're handling a product that may be a concern, so for that few minutes, you put the gloves on, you handle the product, and then you very carefully dispose of the gloves right away, so that you really never wear gloves for more than 15 minutes. You need, if you're going to be wearing gloves all day, basically for every interaction, you have to change the gloves. And if there's little interaction, every 15 minutes, you change the gloves. That can be very expensive, but more importantly, wearing gloves creates a false sense of protection. And so it's important to learn that these are practices that are not helpful. And so that's where we say having to learn and then disseminate that information quickly, and to be willing to be on a regular basis and discovering what is new. And also, most importantly, and we're going to discuss this a little bit later, but most importantly, what are legitimate information coming to you? What are legitimate sources of information? And I must tell you, Facebook is not a legitimate source of information. Many people take what they read on Facebook and believe that that's, you know, that's a fact. And in reality, it's not. Facebook are people's opinions, and that's fine, but they're not facts. For me, I go to Government of Canada supported websites and Government of Canada supported information. I don't believe that it's always perfect. I don't believe that there's not area for new information and change. And so I try to source on a very regular basis every few days, because the whole COVID-19 world has information that we just don't know. Now that we've been involved for 6 to 9 months, we're getting a better understanding and some of the grassroots of what we should or should not be doing. We're trying very hard here in Canada to take it seriously, but the reality is that no information coming out is perfect, because nothing has had a very long history to let us know what might be some of the repercussions on a long-term basis. For example, I wonder, what are the repercussions on a long-term basis of using hand sanitizer the way we started using it? I mean, it's constant. Everywhere you go, every store you go in and out, you're using hand sanitizer. It's not once or twice a day. It's pretty well once or twice every 15 to 20 minutes. And so I wonder, what is that doing to our skin? And not to create any fear, but a story came out on one of the programs recently that's supposed to be well researched, and it's asking that you read the bottle as to what ingredients, and I'm not versed on it as yet. It only came to me a couple of days ago, but some of the hand sanitizers are using an ingredient that is not safe, in that, oh, here we go. People are already afraid of having their temperature taken because of fear of radiation and cancer, which is not in the thermometer. But the truth is that they're saying that some of the hand sanitizer ingredients, not all products, certain products that are being distributed in bulk at low cost, have chemicals that have been known to cause cancer. So if you're in purchasing, or if you're in HR, it's very important to make sure that someone has taken the time to read the ingredients and cross-check with the health and safety recommendations, to ensure that the hand sanitizer that's being used for your people, your employees, and your clients and customers is a safe product. And that, unfortunately, has fallen here in Ontario under the responsibility of HR, because not every organization has a medical or a nursing department. For us, of course, all of our retirement homes and nursing homes and schools now have nursing departments, and it's their responsibility. But For organizations that do not have a nursing department, it is now your responsibility under HR to ensure that the masks that are being used are appropriate and safe and protecting the user, and the hand sanitizer being used is protecting the user on the long-term and on the short-term basis. So there's a lot of learning on a regular, of course, checking Zoom workshops that are available out there. That's one of the advantages of the internet today, is that we can learn information, but then we have to make sure that we don't get overwhelmed or create unnecessary upset, which I certainly hope I'm not doing that this morning by sharing some of the information.
Hi, Sheree. There's in the chat, there's some, you referred to some statistics, and a few participants have indicated an interest in receiving the statistics that you referred to.
Okay, and I believe, oh, I must apologize to everyone. I do not understand why my computer decides to give me a challenge. My chat was up in the beginning and now my chat won't show me. So I believe that you're asking for the information regarding the life of the COVID germ, how long it will exist on a surface like paper, like your car, things like that. And I will make sure to send that sheet along. Actually, I shared it with Suzanne at the very beginning of this, but I will share it with Suzanne from CAWASA so that she can share it with everyone. I found it most helpful at the start of the pandemic, and you may find it most useful as we move into the second wave, because it works as a guide. It was well researched. Surprisingly enough, COVID-19 can exist on cloth for a long period of time. Plastic, it exists most on hard surfaces. Areas that we don't worry as much about is paper, for example, because it's porous and the germ can't exist very long, maybe 2 to 3 hours on paper itself, but on cardboard, it's a longer period of time. And I won't promise that I remember all the statistics on that, so I will definitely share that with you so that you can have that by start of the week. Back onto my slide for a moment. It is important for HR to provide even more support now to managers with respect to the issue of performance, sharing information on benefit scenarios when I'm not sure in your particular country or your organizations what is happening regarding people, parents who have to take time off, or adult children who are required to take time off to take care of young people or parents. But of course, for us, that's a big issue. And so part of the HR preparing for the second wave, one of the questionnaires that HR is handing out here in organizations in Ontario is a questionnaire stating, are you responsible for anyone in your household should COVID-19 come into the home? And so,
so this is a line to an admin.
I'm actually hearing someone. Is that intentional, or is someone on mute? Am I the only one hearing that?
I've sorted it out.
Oh, okay, thank you.
Yeah.
So HR now is, we always had the responsibility to support our managers, but now our managers are feeling more stress. A lot more is coming their way. And then it falls on us to provide more information and more support to those managers. And a big area that managers are going to find a challenge, because, for example, during a time of work from home, during a time where there's constant change as we're experiencing now, the idea of trust and micromanagement becomes an issue. For managers who micromanage, the challenge is that their day now becomes that much longer. And because if you don't feel a mutual trust between you and your team members, then the workload on the manager becomes somewhat overbearing. And so we're going to take a moment just to look at some of the issues involved in trust, because it is so important. The key is managers who lack trust in their staff in the office or within the four walls of the organization will not suddenly be able to develop a new trust when people are working remotely. And so as an ongoing effort, internal education, small support meetings, I'd like to say sending out written information. The problem that we're noting here with written information is that we're getting overwhelmed with paperwork, and it becomes difficult to read through all the content. And so what we're noticing from a training and educational standpoint, that yes, we need to provide the written documentation for those people who do take the time to read carefully, but we also need to have some verbal exchange. It does not need to be face-to-face, but we need to have a circumstance where people are able to, for example, like this Zoom meeting we have today, have an opportunity to listen and or interact either through chat or a verbal exchange with regard to information that needs to be provided more in a current rather than in as a current or an immediately needed basis, versus sometimes when information is distributed in writing, there's an understanding that when I have time, that's when I'll read that. And of course, time has become more crunched now with the challenges around COVID. Trust and fairness are very central to effective management and employee performance. I believe we've always known that, but now with the health issues and the personal concerns, and also being able to assess the difference between, and we had this conversation in our last webinar, the difference between a legitimate COVID issue and an issue where a person might be using our new reality to try to manipulate it to their own circumstance. And I hope that that is not the case in the majority, but it's still a case of reality in the minority. There will be people in every organization, in every walk of life, who see COVID as an advantage to manipulate circumstances for their own purposes. But overall, many people who may have concerns, and some of the concerns may be a result of the anxiety we talked about in our last session. They may have legitimate concerns. I'm going to share one with you that I experienced personally. And because of where I'm assisting at the retirement residence, and where they're asking, they started the voluntary COVID testing in August, and I avoided testing until I was encouraged in a positive way to really consider doing the testing. First of all, it was my attitude that, number one, if I have COVID, you're going to know I have COVID because I won't be able to function. But that was a very self-centered attitude. Though, because of my disabilities, my physical disabilities, I'm probably correct, but let's assume that I'm wrong, that my weak lungs wouldn't react to COVID. So let's say that I was wrong there. I always wondered, why so much testing? Why is Canada spending all this money on testing thousands of people? What is the point? We're testing thousands, up to 20,000 people a day we're testing. And I felt that, you know, as usual, wasting money in the wrong direction, until my daughter, who is actually a nurse, explained to me, the whole point of testing is to try to be able to identify areas or potential areas where COVID could happen because of all the asymptom people that are there who show zero signs of having COVID, but who are carriers. And that's why we're doing the testing. So then I decided, yes, I will do the testing. And they describe it as a, you know, quick, uncomfortable process. But what's different for me, and I will share just quickly, because of my muscular dystrophy that I have, my muscles, for example, and I'm laughing, but it's not funny, muscles on the surface here, I've got bruising on my arms. I don't know if you could see that. Those are muscle bruises because of the change in weather. That's it. No one hit me, no one squeezed me, I didn't hit my arm. My body is so sensitive to changes in temperature that I develop black and blue marks on my skin. So I'm thinking it through, and they're saying, oh, it's no big deal. You stick it up the nose and it curls and boom, and it's out. It's a few seconds. And then I heard horror stories where people were tested at the hospital and it was extremely painful because they're doing so many and they're less gentle about it. And then at our facility, people kept reporting that, wow, what a difference. The nurses here are so gentle. My testing, I feel nothing. So I went yesterday, and I won't hide it. I went through extreme anxiety prior to my test. I was shaking, my breathing got short. I was just very, very nervous as to how will my body respond to a jab into muscles that are up here that we don't see on a regular basis. And the nurse was gentle and wonderful. Before I could say to her, "You were great," I became paralyzed. Gently paralyzed, I call it, because I could still breathe, but my body would not move. So it took me about 10 minutes to recover, which in my world is nothing to consider. But in someone observing what occurred, it was a shock. But so testing can have some discomfort for some people, I being one of them, but I must tell you, after the fact, and I'm waiting for my results, and I will share that with you next webinar, but after the fact, I felt very relieved that I was able to participate in a process to assist my community. I felt very thankful that I was able to participate in something to give me information to make sure that my conscience is clear. But also, of course, I'm very lucky because I live in Canada and it didn't cost me anything.
Question, Sheree.
Yes, sir?
This posted by Andrea White. Do you
Yes.
have any, it's in the chat, do you have any organizational policies as it relates to blended learning, kids attending school 3 days a week, and off or two, or going to school half day for employees who are parents and does not have the necessary supervision for kids? And bearing in mind that only one parent is requesting time to work from home to supervise child or children.
Excellent point. And again, an area where HR has to get very involved. Our company does not currently have such a policy that I can share with you, but I can certainly try to get information for you in that regard. But in Ontario, there is, it's not a law, but I'm not sure how to describe it, but there is the option for parents to opt out of children going to school at all. That's an option. And what we've learned with the start of school, about 25% of parents have chosen that option. And our government does help to support the parent who chooses to stay home. Financially, I believe, and I've not done a lot of research, I know that in the first 4 months, parents were receiving a hefty amount of money, 2,000 Canadian per month, to stay home with their children and not go to work. It's a lot of money. Yes, we're getting into some deep debt as a country. For the organizations, the challenge is that the job must be kept open for the person. And so Ontario-wide, there is a requirement to protect that person's job, where we as organizations maybe don't have our own policy because the policies are somewhat dictated to us. The job must be kept open. And I shared the little story of the woman that I'm covering hours for, and the fact that she started to work Wednesday, and Thursday, before she got to pick up her daughter from daycare, they called work. I happened to answer the phone. They're looking for mom. When mom called back, testing done. Now she's asking, what is the protocol? Am I allowed to come to work tomorrow, which would be today? And in the school system, the protocol is if one child is suspected of COVID and is waiting for test results, the rest of the family still goes to school. But in our organization, because we're in retirement, the policy is that while waiting for the negative result, the parent is not allowed back into the workplace. Now, until 2 weeks ago, it was also combined with negative result plus 14-day quarantine. We're in the process of change even as we speak, because today is Friday. New information from the government would have been issued yesterday. I do believe that they're working on reducing the length of quarantine from 14 days to 7 days, but that has not officially come out as yet. So there is not a simple answer to your question, but certainly I'll try to provide any written information I can find. And just to recap verbally, because of government policies, all employees are protected. But what does that mean for the organization? Well, we find that many organizations have to lean on temporary staff where possible. But more importantly, what organizations are doing is asking current staff, what is their extended availability? Can they help in this department? Can they multitask? Are they willing to be trained to work in different, in essence, have a job sharing situation? We have to assess within the organization what is essential to be done to keep our client and customer base requirements covered. What is essential in the area of safety, what can be put on the back burner and attended to on a more as time is available basis. And so it becomes very challenging, not just for HR, but also the managers and also for each employee, because that's where the trust comes in. We have to trust employees to be able to make decisions, because the manager cannot always be involved in all of the required information to make a proper decision. So managers now need to do less micromanaging and be willing to share some of the responsibility for the decision-making, providing education when and where possible so that employees are able to function more effectively in these challenging times. Any comments to extend that? Yes, please. Oh, I just echoed my own voice. Are there any comments to extend that? If anything in writing, Mr. Jacques, could you let me know?
Not as yet in the chat, but if there are, I will certainly. Any comments, participants? Otherwise,
I'm going to move on. I hope that little discussion was helpful. And so work from home, that's our next little section. Lessons learned, success stories. Any comments in regards to negative issues with regards to completing work, communication, frustration? Can you write anything in the chat, or is anyone able to make comments? I'll leave a moment for that, and then I'll do some fill-in myself. I wish my chat was working. Okay,
have you tried the bottom of your, if you go to the very bottom of your screen?
See, my information's at the top of the screen.
Okay, you have some information at the top of the screen.
Yeah, I've got like a control panel.
Right.
I have my control panel at the top of the screen, but as soon as I started sharing, my chat stopped.
If you go down the bottom of the screen, there's the mute. You will see the the icon for the microphone, and you continue going.
I'm going to ask everyone to forgive me. I'm going to stop sharing for just a quick moment.
Right.
And see if it changes. Yeah, everything changes when I'm not sharing.
Right. Yeah, I think because when
and
you're
I got
sharing,
my chat when I'm not sharing.
Yeah. Okay.
Yeah, when I'm sharing, I cannot see the chat. That's what's going on.
All right.
Because I see all the chat comments now. I see we have 11. Yeah, so my whole screen changes when I'm not sharing. And when I'm sharing, I'm unfortunately a little bit limited.
Okay.
For future, I'll find out if I can run 2 computers at once.
All right.
It's a bit of a learning curve. Anyway, some of the lessons learned and work from home, certainly in Ontario, everything was going along very nicely. We were hearing about Italy and all the challenges in Italy and Spain and France and all this COVID. And it just did not seem like something that we had to worry about here in Canada, because after all, we're in Canada and safety is always number one. And then suddenly on a Thursday afternoon, a pandemic was declared and everything shut down and everything stopped. No one was allowed to travel. Again, potential for being charged. It came up right away that if your car is on the road and you don't have a letter to prove why, then you can be charged. And it was pretty scary. And then not only were people required to work from home, they were required to work from home with their children at home. Let's talk about super challenge. And not, you know, various age groups and so on, and the teenagers being at home and the little ones being at home. So some of the lessons that had to be learned is we need a contingency plan just in case this comes around again. And again, even though it's a second wave, and in Ontario, we're desperately hoping not to have to shut down. I know that in certain provinces in Canada, certain cities, shutdown has already started. So making sure that we look at, maybe share some information among our workers, managers, as to what were some of the big challenges for the individual. How did they move around or solve the issues? I know that we talked about the anxiety, so let's not go there again. We know that working from home created a lot of anxiety and stress, but what were some of the other issues that were involved? For example, time management. Another example is effective internet communication. Here in Canada, it's a luxury that we always have internet communication, but during the work from home time, there were challenges during the day when even our systems were overwrought, and sometimes internet would go down because of overuse. Mobile networks were going down because, again, overuse. Everyone trying to maintain communication created quite a stress on the system. So what, you know, what were some of the challenges there? What were success stories? Did you have any, and can anyone comment? Perhaps even just saying, yes, there were success stories, because we know there were challenges. So if you could put in your chat a yes, we had some success stories. Can't necessarily share them right now, but if anyone is willing to verbally share a success story, that would be most appreciated. Is there any such situation?
Yeah, feel free. If you need to unmute, you can unmute.
I'm going to stop sharing for just a moment so I can peek at the chat.
We have some shy participants.
Okay, understood. Well, that'll allow us to move ahead. The big key that we discovered in being successful in working from home was flexibility. Flexibility being extremely important. So we're going to discuss some of the areas where being organized and setting up some plans and having some structure was helpful. but it's really important to understand that despite all of that flexibility, also in expectations of, for example, project due dates had to be expanded. Working within teams, not every team member was always available to communicate. So we had to maybe look at taking on extra responsibility within the teams. Lots of options involved. So tips for new work from homers. Luckily for me, I'm not new at working from home because having had my own business for years, I've always had to. And being prepared mentally and emotionally and physically is very important, because one of the things that people take for granted when you're going out to the workplace is that you move more. You know, you have to get up and get in the car and park the car and then walk into work, or you're taking a bus, or here in Canada, which has become extremely popular, is during the summer period, is riding your bike to work, because of course nobody wanted to take the subway. Buses were, by the way, from April until September, buses became free, no charge to take the bus, because they had to limit the number of people on the buses, and they still wanted people to be able to move around. But the buses were still quite empty. The option people chose was to ride a bike, which is a great option, availability in the Caribbean, not a year-round option in Canada. And so, of course, the sale of bikes went way up. And the availability to purchase bikes went way down. Nevertheless, we take for granted that there's some physical movement in going to work and stairs to climb and all those things. When we work from home, you get out of the bed, you go to the kitchen, you make a coffee, and you sit down and you think it's time to start working. And we don't realize that we need to have a morning routine even when working from home. As a matter of fact, more important to have a morning routine, because if children are home, spouses are both trying to share workspace, that stress alone can be frustrating. So important for you to develop your own personal morning regime, your morning routine, that you sit down, you think about it, and you decide what is going to be best for you. And part of that is getting ready for the day and being dressed for the business day. There is a funny commercial on the local radio where one person says, I haven't been late for a meeting in 6 months. I've also never worn less pants. So the idea being that they attend meetings, however, because you're only seeing a certain section of the person when it's a Zoom meeting, or perhaps the option to have no video at all is there. So people think, well, I don't have to dress for the day. Studies have shown that our attire has an effect on our emotional well-being. So it is not a great excuse to say, I'm working from home, I don't have to get dressed. Yes, you should have that formal organizing of your attire and be ready to be prepared to do a Zoom meeting or a video chat on your phone. Because we have less face-to-face in Canada, we believe strongly in a lot more of the virtual, whatever option you're using. All our doctor's appointments today, believe it or not, 90, if not more % of doctor's appointments are now virtual. You don't go to the doctor's office, you do it on video chat. And so more communication within employees, within teams. The shyness of, I'm not going to turn on the video, needs to stop, and I need to be prepared. And skills need to be learned. And I think it's important that HR perhaps provide information. And again, if that's a request that comes out, we can do a whole session, if you like, or part of a session on how to prepare to be comfortable around the virtual meetings, the video chats, and the personal esteem around that. I believe that information needs to be shared with managers, especially managers, and also with employees, so that we remove some of the anxious feelings about being on video. Setting a schedule, not just for the day, but for the week. Because we're under constraints of work from home, communication will not always happen as effectively. Certainly if you're within the organization, sometimes you have the advantage of just walking to someone's desk. Now that goes away. And now even within the organization, walking from one office to the next, one desk to the next, should be reduced. And we're going to discuss that a little bit more later in the program. But setting a schedule, including breaks, so planning breaks, planning meals, making sure that you've got healthy snacks. Excuse me, I'm going to have a quick sip. One of the disadvantages of working from home is that we can get started and we can, if we do get a chance to focus, we go, okay, I can get a lot done, and you just sit there and you don't move. Really bad for your muscles, really bad for your problem solving and your thinking. It's important to get up and stretch periodically. Number 3 is setting a designated work area to use as a workspace. Let's put this all together. If we take the first 3 key points and we dress for work, even put on your name tag. I know that sounds strange, but think about your family. If you're dressed for work and you're looking formal and you're wearing your name tag, it sets in their mind, wait, mom or dad is working. It's not just, a relaxed day. You set a schedule and you've got breaks and you share that with members of the family. Say they know, here are the times I'm free for you to talk to me. Otherwise, I'm at work. Even if you have to create a sign that says quiet, work in progress. Very important to set a designated work area to use as your workspace, especially when there are multiple people in the home, because you don't need teenagers or young people getting into your workspace or into maybe important information or whatever it is that you're trying to organize. But interestingly enough, one of the areas they say in working from home is if having a mobile workspace helps you concentrate, because remember, when you go into the organization, you're getting up and moving more, you're going to meetings. When you're working at home and you're sitting in meetings at your desk, which could sometimes last hours, it's not good on your physical being to stay in that one position. So if you find it helps you to concentrate, you can set up multiple workspaces in your home so that you can move from one space to the next, just like going from a meeting to your office to someone else's office. You can sort of create that. Certainly in the Caribbean, you've got much more advantage than we do in Canada. This young man is working in the garden with his little portable because the laptop and the wireless allows us to do that. Another thing is keeping clearly defined hours. Don't allow the fact that you're working from home to create such murk, dissolving of the specific start time, end time, and so on, that you become frustrated and stressed, and that your family becomes frustrated because, into 8 o'clock in the evening, you're doing work from home, and 4 o'clock in the afternoon, you're dealing with other issues. Try to set a defined schedule and perhaps use members of the family to help you by having them designated as responsibility to entertain the younger ones at different times of the day, times where it's becoming more difficult. Get the older siblings to take some responsibility, provide guidance, be a coach at home, and that can really help everyone. Number 5, don't get distracted or too distracted by the news. Oh, I know I was doing it at first too. Everyone was. We were glued to the TV, listening, and it can get very stressful and depressing. And most of all, it can distract from what you're trying to get done. Under the anything else, I put in quote, Canada could lose its ability to manage the pandemic due to a spike in new COVID-19 cases, the country's top medical officer has said. And so you can spend a lot of time. I mean, 2 hours can quickly go by where you're just investigating what's being said, and all the politicians are doing their daily talks. And if you listen to every one of those, your workday is going to quickly slip by. And I know, as I say, in the beginning I did, and I had to learn to shield myself from that. But of course, you cannot hide from the news. It is important to keep abreast of what's going on. So designate time to do that. Some more tips that are really important: communicate with your family, communicate with your team members, your coworkers, your managers, and with HR. Communication is always identified as the biggest issue that creates stress, animosity, extended deadlines, getting work done. Communication is always blamed. But interestingly enough, communication is done by individuals and within groups. So we really need to focus on more of that. We can use social media groups to communicate. For example, one can create a Facebook social media group among group teams. And what's nice about that is you can send chat and information when it's convenient to you. The person can read it and respond when it's convenient to them. So Facebook can have some real advantages. Of course, texting is useful, email, and just setting up little social work groups on Zoom, setting up Zoom meetings. Some of the meetings don't have to be formal work meetings. I know my friends and I'm a weekend dancer. We love to dance, and we can't. It's one of the things. They're allowing us to have 30% of our capacity for restaurants. So you can have 30% of the people that you normally have. Some organizations I'm on number 7, socializing. Some organizations are providing live entertainment outside, which is dying quickly because our nights now are 2 degrees. So you can't really have much evening entertainment. It's too cold. But no dancing has been allowed. And that's quite a challenge for some of us. So what my friends and I did, we created a Zoom group, 3 of us, where we get on Zoom and we dance in our own living rooms, but we share it with each other. And it's a way of dealing with the stress and the frustration of not being able to get together. So you could use that at work and have socialized online social groups where, you know, you set up your coffee break and 5 people where you would normally meet in the canteen or the restaurant or the break room. Now you set up a break time and you all have a break together online. It helps to reduce some of the stress. Be respectful of family members and of your own time and space. Try not to make it that your needs overpower the needs of the whole family. And that's where, if we go back to setting up a specific workspace and setting up specific work times, it becomes easier, and you can use the word respect to the family and saying, I'm going to respect the fact that you need me during these times. You need to respect the fact that here is when I'm designated to work. It's like I'm not here, and we need to be able to get through this together. And a big area that is always a reality, but becomes extra important during a thing like a pandemic, is to avoid scams. And scams may not be obvious to you. It may not be, oh, someone is trying to sell me something or get me involved in something. A scam can be very easily information shared either through an email, some social media like Facebook, information that is not legitimate, and creating a bigger scare. So, for example, there was a big, very long-term social media scam about the whole COVID being a conspiracy, and that there is really no such thing, and all these world leaders got together and they're trying to upset everyone and upset the economics, and they're trying to, you know, hide all the things they're doing wrong by putting COVID out front. And there was a whole big conspiracy theory, and information kept flying around. And I know, I don't know if I mentioned this to you before, but I asked one of my friends who I kept as a friend, but I asked her not to send me any information relating to that. I took time to review it, and I realized that it was not legitimate in my opinion. And I said to her, please don't send me anymore. 2 months later, she said to me, we kept our communication on other topics, but 2 months later she said, oh, you know, you were right. I learned now that that was not legitimate. And so being respectful to others and asking others to be respectful to you. I said to her, please don't send me that information. It upsets me and it causes me anxiety at a time where I'm trying to sort out and make decisions for myself. So she stopped, you know, and that's what we're asking about, being respectful. And at the same time, we're saying, try to avoid scams. Not always possible, but if it's too good to be true, if it's too outrageous to be realistic, maybe it's a scam. The only problem is COVID-19 is not a scam. And 9 months ago, it would have seemed extremely unrealistic, all the things that we're going through. But, you know, we're humans and we have to be flexible and as much as possible, go with the changes that are required. So before I get into expanding the bubble, I'd like to invite any questions or comments, either verbally or in the chat. So we'll stop sharing for a quick moment to see if there's anything comes up in the chat.
Well, there's nothing in the chat right now. I
Okay,
think
nothing
we
new there.
had some folks who had to leave at 11. I think.
Okay.
Yeah.
So I do apologize to those. I was hoping that we could keep them till 11:15. So I do apologize.
Yeah.
But hopefully they'll catch the last part of the presentation when it's sent out. We're going to move now to expanding the bubble. Because in the beginning I explained a little bit of what the bubble means to us here in Ontario, at this point I would like to talk about what it means expanding the bubble for you in your communities and what we can do to help keep us safe. The reality is that we need to expand the bubble no matter what that means. Whether, I know for us here in Ontario, for the retirement community, do you know that people in retirement homes have not seen some of their family members, sometimes any family members, since March the 19th? And that's created some anxiety and stress and some real upset for them on a long-term basis. Being forced to have all meals in their room until 2 weeks ago has created some physiological stress. So our government has said that they will open up and they will designate opportunities where family members can be trained and go through certain education, then approved to go visit their family members that are in retirement. So that's how we're expanding the bubble. And there's still a fear that once people start moving into retirement, the death toll for our seniors will go up, because the weakest side of the population is the seniors, and they are the ones that COVID's not just another flu to them, it's a life-threatening, and also people who are overly sensitive with lung issues and heart issues and diabetes issues. Expanding the bubble means that opportunities for those people to become sick and potentially die becomes a reality again. But we cannot keep the bubble closed, because economy is required and is the wealth and resources of the country or the region, especially in terms of production and consumption of goods and services. Tourism has to restart. And the reality is, COVID or not, and the big fear of travel or not, Canadians are already getting antsy because the nights are cold and we want to know, where are we going, when are we going, and how safe will it be to go? So, you know, we need to open up our economies, because we need to flow the cash and the credit and the debit. It really needs to flow so that, you know, we can be realistic about maintaining salaries and jobs and so on. So to help with that, a few steps to decrease the COVID transmission in your community. It is best, believe it or not, COVID is so simple. Limit the number of contacts you and your family members have. For people working in tourism, As the bubble expands and people are coming into your facilities, tourism organizations, I know you're not that, but they will need to have some discussions. HR in tourism will have to have discussions around the idea of offering the opportunity for people to live where they work. The retirement community that I help with, when they HR put out the questionnaire, do you have family members that you are responsible to, or will you continue to work should there be an outbreak at our facility? I said I wouldn't talk about Ontario, but I need to give you the examples. An outbreak at our facility, which has 200 residents and about 130 staff, an outbreak means that one person, resident or staff or visitor who has been in the community and that has, signed in and has been recorded as visiting the community, one person associated with that community testing positive for COVID creates the opportunity for what we call an outbreak. So if the person works there or lives there and they test positive, we are assuming an outbreak. We're assuming that more people will be affected. On the positive side, we've already experienced in the last 3 weeks a number of retirement communities who've had single outbreaks that were limited to the single person, but that's because they reacted quickly. So I can't dwell on what tourism should do because you're not tourism, but we will dwell on what you need to consider. Should there be one person in the building, not the organization, because the organization may have multiple buildings on the island, but if a person in one building or a person who travels from one building to another within your organization tests positive, what protocols will you have ready in place? Here, we shut down that building. We shut it down. We don't allow people to come in. We immediately start testing. And I know in St. Lucia, that's more of an opportunity. I don't know with the other islands, but we start testing everyone right away. We recommend isolating from family members. So if someone tests positive in an organization, let's say the organization I work at is called the Waterford Retirement Community. If someone tests positive at the Waterford, I will no longer go in. I will stop going in. I will isolate myself from my own family members. I will get tested and I will be isolated for 14 days to make sure that I do not have COVID. And so at the end of the 14 days, I will get tested again to show that I'm still clear. So I'll get tested right away to say that, no, I'm not currently COVID positive. And then after 14 days of isolation, I'll be tested again to say that I'm still not COVID positive. But I also will not go into that community because I don't want to get infected if I can avoid it, because I don't know how sick I'll get. I'm a candidate to, I'm considered a candidate to go into the hospital should anything happen. Now, as a big community, what HR has done is ask those employees who will stay working and what arrangements will they make to maintain the safety of their family and not to spread. And so what that organization has agreed is, for some employees, they may have to put them up in a hotel. Where possible, they'll have them stay on site. They're going to designate, because it's a place where people live, they're going to designate certain rooms for people to stay. And because it'll be 24-hour work shifts, because the number of employees will be reduced by a huge percent, because all those with children won't come to work. So there's a big preparation. You can see just by the little I'm telling you how much is involved. Hopefully for your organization, it does not need to be that complicated, but you really should be having that conversation with your management team, with your HR team, and overall with your employees, and start to get yourself ready. But number one is maintaining the distance, wearing the masks, and being with as few people as possible. When you're near others, make sure you wash your hands. Where possible, change your clothing. If you're worried that there may have been an exposure, get those things washed. Don't keep increasing the potential for the spread. So preparing for the second wave, open discussion with, I've already said all this, but you want to identify the best and the worst case scenario. For the Waterford, the best case scenario is a person is identified positive. We start our lockdown procedures, so no flow of people in and out. We clean. We test everyone, and within 14 days, we're clear and we're able to open up again. Worst case scenario, the virus spreads, our seniors, and the average age of the persons living at the Waterford is 88 to 92. I know that's a bit of a spread, but the majority, we've got so many people that are coming up to their 100th birthday. It's amazing. Where every week we're celebrating a 96th birthday, a 97th birthday. So the age of our population, of our 200 people, is quite high. The problem is, should one person, one resident get it, the chances are many will get very sick, and we'll have to designate a section of the building for COVID only. Employees will work with COVID only, so we won't cross employees between COVID and non-COVID people. You can see how complicated that can get. So you need to have some scenarios organized and be able to identify and share in advance the protocols. Example, yesterday when the young lady called back and said, my daughter has to go get tested. What does that mean for me at work? I didn't have the answer. I answered the phone and I couldn't tell her because the procedure had not been shared with me. I didn't know what was the protocol. I do now. The protocol is you don't come to work until that person's test comes back negative. You also need to be tested, and yours needs to be negative, and then you can come back to work. So I'm hoping that that's some information that's been useful. I do believe I'm past my 1 hour till 11:15. We're coming up to the 11:30 time slot. So I'd like to, for one last time, ask if there are any comments, questions, or discussion points that you would like to have at this time. I'm going to stop sharing and peek at the chat.
Well, I guess it seems like we have a lot of passive participants, or
yeah, and a few people had to
listening and understanding. No, just one person had to leave.
Oh, okay.
But there aren't any questions in the chat at this time, so.
Okay. Well, I guess the key is if anything comes up later, if anything that you have a question, please feel free to share it with Suzanne and myself and Mr. Shaw, and so that I can make a response. And if it seems something that needs to go to the group, we'll share it with the group. If it's something that's of a more personal nature and you want to contact me directly, you could please, you should have my email. If not, Suzanne will share that with you, and happily I could keep a communication, just a private one if that's needed. But most of the COVID questions, I think, are questions that many people will have, and there may not be one answer or one solution.
Okay.
So with that, Mr. Jean, I think I am finished for today.
Well, we'd like to thank you again for sharing all this information with us. I think we went more than our designated hour, but that's fine. People seem to have stayed on and been pretty attentive. We will continue again in a fortnight's time, is it?
Yes.
We will be sharing with you on the correct time. I think it's 10:30. So
10:30 to make it a little easier.
So
I do apologize for going over.
Well, I thank you for giving us extra time.
Oh, no problem.
And it made up for those who came in a bit late.
Yes.
And again, it's from mea culpa. And so you have a wonderful weekend, everyone, and do keep safe.
Thank you.
Thank you.
Thank you, Sheree. Thank you.
Thank you.
Okay. Bye, everyone.